Hey guys, here I am doing a full TMJ workup. As you can see, the first muscle I am treating is the splenius capitis. In order to identify the splenius capitis, you're going to roll off of that mastoid process with your thumb, and then you are going to feel a depression of where your thumb fits perfectly. That is going to be where the splenius capitis attaches to the occipital bone. So when you are assessing this muscle, what you're doing is you're placing your thumb in that depression and you're pushing in and up towards the occipital, and that is going to tell you where your patient is having referred pain. Typically, I like to put counter pressure on the patient's frontalis just to make sure their head is not flying forward and I'm well supporting their neck while I'm applying pressure. Moving on to the trapezius muscles, we are starting on the left side. As you can see, I am using my thumb and I'm placing pressure in this area to assess where the patient's having pain. I usually like to inject over 2 to 3 injection sites. So I always assess my patient and I ask them if the pain is mild, moderate, severe. They respond, and then I also ask them if the pain is referring. Referring pain means that the pain is going to go elsewhere. So when you're applying that pressure, it's going to tell you that there's a true trigger point in that area and that you need to treat it. This patient has very strong TMJ symptoms, so we are going ahead and needling with some lidocaine and Botox in a 3 ml Comfort Tox syringe. So as you can see, I have a 25 by 1 inch needle on there. I am needling. I'm always keeping that syringe relatively parallel with the floor. When I'm going into this injection site, the first thing I'm doing is I'm pushing a little bit of that product in hopes that the lidocaine is going to provide my patient with comfort. Once my patient is numb, I'm then moving the needle in and out of the tissue like this, and I am making sure that I'm really not going over 3/4 needle depth in this area. We really want to make sure that your needle is in a safe area, so tenting up that tissue and watching that needle depth is really going to be a part of safe injection technique. From there, I'm going over to the lateral injection site that I assess, and like I said, I'm going in parallel with the floor. Once I get about half needle depth in, I am pushing a little bit of that lidocaine, and then I always tell people count to 10. Give your patient a couple seconds for that numbing to kick in. The reason being is it can be pinchy, but overall, if that numbing has time to set in, a lot of the times they're just going to feel pressure. So this patient's relatively versed with this procedure, so I always tell my patients, communicate with me throughout it. Let me know if you're feeling lightheaded or you need a break or something is hurting. But this patient is relatively comfortable and really just gets relief from this treatment. So overall, you're moving that needle in and out, making sure you're not hubbing that needle. The reason why we're tenting up that tissue and watching our needle depth is prevention of a pneumothorax. So just keep that in mind. Safety of the patient comes first always, and that always is related to safe injection technique. So after she's done, she might be a little sore and tender, but overall that lidocaine is going to give her short-term relief and that toxin is going to give her long-term relief.